Good evening, everyone. Thank you for joining us tonight, whether you're coming from the beach, the mountains, or your home office. Welcome. I'm very excited about tonight's presentation with Dr. Clifford Olson. But before we get started, I just want to take a moment to say thank you to Cindy Kim of Alternative Communication Services for providing CART this evening. If you don't have captions already started on your computer, just click the CC button, the closed caption button at the bottom, and you should have captions. Again, thank you, Dr. Olson, for joining us tonight. I'm very excited about this presentation. It's a question that we get quite frequently from our constituents about whether or not it's a good idea to buy from Costco. Dr. Olson is a board-certified audiologist, holds his doctorate degree from the University of Illinois at Urbana-Champaign. He's a member of the Academy of Doctors of Audiology, a fellow of the American Academy of Audiology, and holds his certificate of clinical competency from ASHA. He's also an adjunct lecturer at his alma mater. Welcome, Dr. Olson. I know this is going to be a popular presentation. I'm going to let you get started because I know we'll have a lot of questions at the end.
Great, thank you, Nancy. And before I get started, thanks to HLAA for asking me to do this presentation. I know that it's been a while in the making. You guys just got done with having a great conference. I think it was up in Minnesota, if I'm correct.
Yes.
And so I know that we were kind of postponing this till after that. And we had put in some time to identify what is one of the hotter topics in the industry right now. And this is absolutely one of them. So I'm more than happy to give my opinion. Anyone who knows me already, particularly from the YouTube channel that I started about a year ago, there's no shortage of opinions that I have about our industry and what's happening in it. So I'm very excited to kind of talk about this topic here today. So you gave a great background on me. I'm going to kind of elaborate on a couple other things just to give you an idea of how I came into this industry. I was actually diagnosed with a single-sided hearing loss in the military. I was in the Marine Corps, enlisted in 2001, right before September 11th, and ended up going to boot camp in 2002. Which is where they actually found the hearing loss. So I had to go through the typical process of getting the hearing testing, rechecks and going in for an MRI to determine if it was a tumor or something like that on my auditory nerve. Fortunately, it wasn't, but I did have the opportunity to really work, alongside of an audiologist that I was being tested with. And I remember thinking, that seems like a pretty cool profession. So that's kind of how I got introduced to the field of audiology. After I got out of the military, like Nancy mentioned before, I went to the University of Illinois, which is where I got my doctorate. And then shortly after I graduated, I actually started Applied Hearing Solutions, up in Anthem, Arizona, which is where I currently practice now. And I'm, in some circles, I'm better known as Dr. Cliff Au.D because that is my YouTube channel where I have a bunch of informational videos at. And the whole concept of me starting that channel was really to help individuals make better decisions, consumers make better decisions on what they're doing with their hearing healthcare, where they're going, who they're seeing, what technology to inquire about, and really put them in the driver's seat because the information that was accessible out there on the internet seemed to be more marketing driven rather than information driven. So I wanted to make sure that I was able to get real information out there for consumers. All right, so we're talking about Costco. So this is not anything new. Costco has been dispensing hearing aids for years. They've been dispensing good technology for years. But I do have a disclaimer before I go into this. As you know, I own a private practice. Costco is technically one of my competitors, even though I don't necessarily try to essentially speak to the same demographic from a clinic standpoint as Costco does. They're about 15 miles south of me, which is a pretty good distance. I'm up north of Phoenix and they're on the further in towards the city. And I've spoken to Costco hearing care providers over the years, so I have a good concept of what actually happens inside of Costco's. None of these individuals were able to directly comment, though, for the purpose of this webinar. So hearing aids at Costco, Costco is starting to increase their market share. They are, as of 2017, they're about 12% of the hearing aid market. They've been able to do this largely because they're able to acquire devices from manufacturers for a lower cost, which means they're able to pass that cost savings onto their Costco members. And so anytime that you can essentially sell a lower cost product, but it's still a quality product, you're going to end up being able to sell more of them. And so that's what Costco's been able to do with their business model. Definitely a sales-driven business model there. And so this is what the Costco Hearing Aid Center offers. They do have their good pricing, of course. They have really good technology, premium level technology, couple different levels, but they're definitely well known for having premium good devices. They do free demos for you that you can even walk around Costco with. They will, it's something like a 6-month return period. So you really have a really long period of time that you can actually go with those devices before you actually commit to owning them. They do free hearing tests, of course, which is essentially required because they don't contract with insurances, which I'll touch base on later. So they're actually required to give free hearing tests. You get free follow-up appointments, free hearing aid cleanings and checkups, free loss and damage, free warranty periods. Now, the term free that I use, you have to remember, it's not technically free. You are actually paying for these services. And it's just you're paying a low price for these services because the cost of their devices are substantially lower than what the industry standards are. And they do sell good, reputable brands. So all of these brands up here on the screen are well-known hearing aid manufacturers. The one that you see in the center, their Kirkland Signature brand, which is their, essentially you would consider that like their flagship because it's branded by them. Those are Signia devices. So they were previously Resound devices with all the contractual stuff and pricing. They have switched their flagship brand to a Signia device that is, of course, rebranded to Kirkland. So let's jump right into the pros. The pros of Costco, number one is definitely the technology levels. They have mid to high level technology. They do sacrifice in some cases some of the features inside of those devices, but largely it would take a really experienced hearing aid user to really identify those differences between their somewhat defeatured products versus the high-end products that are direct from a manufacturer that you would find in a typical audiology clinic or hearing aid clinic. That being said, the technology is still really good, but there are also some cases where the technology might be a little backdated in a way to where you might not be getting the absolute most recent release from a manufacturer. You might be dealing with their previous generation, but still good devices nonetheless. Hearing care professionals. So there's rumors out there that you would have someone from the tire department, let's say the audiologist was out sick, and then someone from the tire department would come over and actually treat people with hearing loss. And that is not going to happen. I mean, each state has requirements that you have to be licensed in that state to dispense hearing aids. I'm not saying that someone who previously worked in the tire department who went and got their hearing aid or hearing instrument dispensing license couldn't come over into the Costco Hearing Aid Center, but that's not something that Costco would risk their essentially their business on by going against those state licensure requirements. Number three is that they're open on weekends. I mean, with busy schedules, working adults, being able to go to a place that is open on the weekends is definitely a plus. I know that when I go to Costco myself, I tend to go on the weekends because I'm working every other day of the week. And then number four, the one that everyone talks about, of course, is definitely cost. Cost at Costco, I mean, it's in the name, right? So the Kirkland Signature 8.0 premium digital hearing instruments, I pulled this right off of the Costco website. You can get a pair of, this is premium level devices for around $1,600. Now that's their Kirkland Signature brand. The other brands that they have, so the Resound, the Bernafon, Phonak, and Rexton, you can get premium devices. This is per ear. So what you're seeing on the right side of your screen is per ear for devices. It ranges anywhere from that around $1,300 to $1,500 per ear. And some people don't believe that they actually do custom products there. Costco does do custom products at their location. So you don't have to essentially always get what's popular out there right now, which happens to be the receiver in the canal technology with a generic rubber dome. If your hearing loss necessitates it, you can get a custom product, and you can get a custom mold on the end of that receiver and canal device as well. All right, so let's jump into the cons now. So that's it for the pros. Con number one, and this is the one that I'm probably, I view as being the biggest negative, is that they do dispense locked hearing aids. So their Kirkland signature brand, if someone goes to a Costco and gets that hearing aid, very good hearing aid, and then they take that device and they either move to a location that doesn't have a Costco, or it's not convenient to go to the Costco, or they for whatever reason, the hearing care provider that they worked with, they didn't mesh well with, you can't take that device and get it reprogrammed by another hearing care professional unless that professional is actually inside of a Costco. So you have to be aware, and this might not be a con for some people, but in my clinic, it's an issue. So on a regular basis, I have individuals from Costco, for whatever reason, they've decided that either they moved here or they have mobility issues, can't get back to the Costco, and they need to stay local. I can't adjust those devices. I can check them. I can see if they're programmed correctly or not, but I can't fix them if they do have issues going on with them. In terms of, would you ever find yourself in an area that doesn't have a Costco? Costco is very widespread. There are hundreds of locations across the United States, Puerto Rico. There's locations across the world that you can go into. And if they have a hearing care center, then that hearing care center would be able to adjust those particular devices that are sold by Costco. Number two is that they can be busy. There are cases, I live in Arizona, in the winter time when it gets really busy, and we all know that there are snowbirds who come from these cold climates down to Arizona. If you find yourself in Arizona in the winter time, there can be delays between when you can schedule a hearing evaluation. You can do walk-ins. You can walk in, take your devices, but there's other walk-ins that happen as well. So there can be cases where there can be a delay between when you actually get your service. And, you can walk around the store and wait. If they have time to kind of squeeze you in at certain times, they might be able to do that. But you just need to be aware. This isn't a problem in a lot of places, but some places, like here in Arizona, it can be a problem. So if you're someone who's short on time or you need extreme consistency with that, it might end up being an issue. Number three is low repeat business. So this is essentially a benchmark that you would look at to determine what is the level of quality of care that you're receiving, what is the level of quality of devices that you're receiving. Costco, and I've heard this from several different industry sources out there, has around a 20 to 25% case of where people come back and actually buy their second set from Costco, which we would deem as being on the low side in our particular industry. And, if you should really be around that 50% or higher of individuals coming back to you to purchase your second set of devices. And the reasons for this number being on the lower side is speculative. I mean, we don't exactly know. There's a bunch of different factors that could go into play with this. And different people have different desires from the hearing care that they're receiving. And so if they're not hitting all of they're checking all those boxes, so to speak, it might lead individuals to not get their second set from Costco. And number four is that they don't accept insurance. So another hot topic, and we could probably do another webinar on this, is insurance in the hearing aid industry. There actually are, and I have a lot of individuals who use insurance in my practice. So I know that there are some insurance plans, and of course Medicare does not provide hearing aid benefit, but there are a lot of insurances out there who do provide hearing aid benefits. There are several patients of mine, more than several, that have 100% hearing aid benefit through their insurance. So it really depends. If you have good insurance that actually has hearing aid coverage, you might not actually save money by going to Costco. If they don't take your insurance and your insurance would pay 100%, it would be a better idea to go to someone who is either in network with your insurance or who can use your out-of-network benefits. That being said, there are situations where you could probably obtain the information and submit it to your insurance carrier if they do have good out-of-network benefit. So in some situations, you might be able to get away with submitting your insurance that way. Okay. So now what do I think ultimately? I mean, I really want to come across, I want to convey to you that I really am impartial, whether it's Costco, whether it's somewhere else, whether it's my clinic. As long as you're getting what you want, I am okay with that. And so I don't want it to come across as I'm being biased toward or for or against Costco in this situation. All of these pros and cons could generally apply anywhere. Right? You could come to my clinic and have certain cons in your eyes that would be something you wouldn't want to come to my clinic for, and so on and so forth. So even though the way I perceive the pros and cons of Costco might lead it more into a positive or negative category for me, it doesn't necessarily mean that those are pros and cons for you. All right. And another thing, I think Costco, perhaps better than anyone, is great at creating awareness about hearing loss. Having the accessibility and the convenience of going to Costco and walking around and seeing that someone could give you a hearing test and actually see what your hearing is like. There's no pressure of anything. You can just walk in and get your free hearing test, and that will create awareness of whether or not you actually have or don't have hearing loss. And I think that is absolutely phenomenal what they're doing there. They also do a great job of serving a particular patient who either requires or demands low-cost technology and treatment. They do a great job of that as well. And they do have the capability of treating hearing loss just as well as any hearing aid clinic out there if they have a good provider who knows what they're doing, who's willing to take the time with you in order to address the issues that you're having with hearing loss. And so that really equals your number one factor for success. Is the individual at Costco who is serving you, are they doing all of the things necessary to ensure that you have success with hearing treatment? And so what does this mean? If they're not maximizing the performance of the hearing aid, it doesn't matter how cheap or how expensive the hearing aid is, you're not going to receive all of the benefits from that hearing aid. And it doesn't matter where they work, right? They're essentially, I'm a no excuse kind of guy. And this is probably my military background in some form, is that I don't care what their level of education is, whether they're a hearing instrument specialist, whether they're an audiologist who's been doing it 20 years. I don't care if they only have 30-minute appointment times or if they have 2-hour appointment times. There is no excuse for low quality of care or poor quality of care when it comes to treating hearing loss. This is a health issue. It is a brain level issue, and it should be treated accordingly. Having excuses of, well, I only have 30 minutes for you today, so I'm going to cut corners, that, in my eyes anyway, is unacceptable. But again, anywhere you go, there could be a hearing care provider in a regular clinic. There could be a hearing care provider in a Costco. And either way, it's unacceptable for them to cut corners on you. And then the second factor for success really is you. Where do you come into this equation? It really is, and I believe this, and there's a term out there called caveat emptor, which means buyer beware. And it is your responsibility to understand and know and take a ownership of your hearing loss treatment, which means it's your job to ensure that they're not cutting corners on your treatment. It's your job to ensure that you're receiving a complete evaluation, not just a free hearing assessment. It's your job to ensure that you've been recommended the right devices for you, not what everyone else is getting, but what's right for you. It's your job to ensure they're programmed correctly. It's your job to ensure that the devices are maintained properly. And it's your job to ensure that you're receiving regular, consistent support. okay? And so then the next question people give me is like, well, how do I do this all on my own? Well, you don't have to. There's information out there. But before we get to where you can find that information, we need to know what you actually need to look for. So these are the 4 things that you should demand from anywhere that you go, Costco or not Costco. Number 1 is speech and noise testing. Now there are individuals out there like, well, that doesn't really tell us a whole lot. They're still going to struggle in noise if they struggle in noise. And I don't believe that, right? So speech and noise testing, what that will ultimately tell us is when we do a measurement to see how well you're hearing in a background noise situation by actually playing noise in your ears while you're hearing and repeating speech back to us, it will give us a particular score on what your brain's ability to separate speech from noise is, assuming hearing aids were programmed properly for you, all right? And you can do this before you even get hearing aids. And it will give us your SNR loss. And I have a graph up here, or rather a table up here to show you what I'm talking about. So if you actually scored a 0 to 2 on that particular test, we would consider that you have normal hearing in a background noise situation, assuming your hearing loss is treated appropriately to your hearing loss prescription. And that would dictate a certain level of technology. But the further the worse that you get at being able to separate speech and noise, the more it necessitates better technology, and the more it may necessitate using some kind of an assistive listening device like an FM system, like a remote microphone, something that can help you cut through background noise more. But devices have to be programmed appropriately to get all of this particular benefit in a background noise situation. And if I don't have a background noise test, I don't know whether or not it's me programming you wrong or whether it's your brain is not actually capable of separating out the speech and noise. That's why this test is so important. The second part is which hearing aids are actually right for you. Like I mentioned before, are you being fit with the same device as everybody else because that's just what that hearing care provider likes to fit? Or are they spending time identifying all those individual factors that you may have that another individual may not? And that may dictate that you need an invisible in the canal device to suit your needs and what you want. Maybe that dictates that you need a device that has a custom ear mold on it so we can have a very specific vent size to control for feedback or whistling issues. There is a whole variety of different factors that can be uncovered for this. Not everyone has to get the standard receiver and canal behind the ear device. If that isn't something that's going to work for you, then you should be actually steered in a different direction to another product which may be more complex for a hearing care provider to fit, but will ultimately give you a better response with your treatment. The third one is real ear measurement. So this is the foundation of what any fitting should have. Now, the good news is that Costco actually mandates that their hearing care providers provide real ear measurement, all right? Now, this is the only way to ensure that your hearing aids are programmed correctly to your hearing loss prescription. I have a picture of it up here on the screen for you. That big blue device that you're seeing sitting on the desk, that is a speaker that we are playing sound from. On the patient's ear, we have, of course, the hearing aid that is down inside of their ear and behind their ear. And there's a little probe tube that goes inside of the ear canal as well. That probe tube is actually measuring the amplification of the hearing aid as it's amplifying the speech coming from the speaker. And so what this is telling me is what impact that the ear canal is having on that sound. And unless I measure inside of a patient's ear canal, I have no idea what the programming adjustments are doing inside of the patient's ear. And so you're essentially, if you don't do this, you're programming blind. And while the manufacturers, they do a great job of trying to, make estimates and give you the right amount of amplification in the certain areas, never have I ever done a first fit, which means hit the auto program button and have it perfectly match a hearing loss prescription. Never, not once. Now there's some people who may not be able to tolerate that level of amplification, and that's fine. We back them away from that level of amplification, and over the course of a fitting period, we baby step their way back up into it. The area that you will hear your best is when you are at your hearing loss prescription. So I'm going to show you on this screen here, bear with me, the hash mark line. So if you look at the purple hash mark line, that is a prescription for a particular type of hearing loss. This just happens to be a high frequency sloping hearing loss. On the top half of the screen, the solid purple line is the sound coming out of the actual hearing aid inside of that patient's ears. What you want to have happen is you want the solid purple line to overlap with the hash mark line. If they are not overlapping with the hash mark line, essentially you're either overshooting the prescription or you're undershooting the prescription. And when you do that, you cost yourself speech understanding, plain and simple. Now, after we make the adjustments, we have what we have on the bottom half of the screen, where those solid lines and those hash mark lines nicely overlap with each other, which indicates to me that the patient has a really nice fit of those hearing devices and they are programmed very well. Now, you can do real ear measurements and get a measurement on top of that screen, but if you don't adjust it off of that, you've technically done real ear measurements, but you haven't done it well. Right? It comes down to the level of precision. And so this is where military experience somewhat comes back into play. Everyone asks me, Cliff, so what did you do in the military? I was a scout sniper in the military. Well, Cliff, how the heck does that apply to audiology? How did you get here? Well, the level of precision that it takes to be a scout sniper is the exact same amount of precision that it takes to be proficient in audiology. If you take that level of precision and apply it to the way you fit a hearing aid, you will absolutely get better results with that hearing aid. But again, it goes back to, is that hearing care professional going to take that time and that level of precision in order to do so? And then the fourth point here is the structured follow-up care. It does you no good if you get fit correctly initially with the hearing aids, and then you don't see your hearing care professional for years. And then you start that steady decline in performance, and then a year or two goes by and you're like, well, what the heck? I'm just not hearing very well. Well, you've probably not been hearing as well as you possibly could throughout that entire time. And that's because hearing changes, your prescription changes. Hearing aids will degrade in performance. One of the things that we have out there is called microphone drift, which is where when moisture gets exposed to your microphones and you're not dehydrating them every night, or you're not getting them properly maintained, those microphones will warp and will reduce the hearing aid's effectiveness, particularly in background noise, which is where everyone wants the most help. And these follow-up visits, if you don't pre-schedule them, if you don't get them on your books or the hearing care professional's books, time will fly and you'll realize, I haven't been in there to see my hearing care professional in a year. And by that point, you've already gone a certain period of time where your hearing aids probably aren't performing up to the expectation level that you would have. This is probably my favorite quote of all time by William A. Foster, and it is, "Quality is never an accident. It is always the result of high intention, sincere effort, intelligent direction, and skillful execution. It represents the wise choice of many alternatives." You can have hearing treatment, but the quality of hearing treatment is the most important factor about it. And quality is controllable. It's controllable outside of Costco. It's controllable inside of Costco. And I know for sure that there are audiologists who are in Costco who are absolutely doing things the right way. And I know that there are ones who are doing things the wrong way. Same thing. Inside of a private audiology clinic or ENT clinic, there are audiologists doing things the right way, and there are audiologists doing things the wrong way. Your job is to identify if that hearing care provider is the right one for you. And if that hearing care provider is at Costco and that is the right one for you, then you should absolutely be going to Costco to receive your hearing treatment. If that hearing care provider at Costco does not meet your particular standards, then Costco probably isn't the best place for you, okay? So here I have a screenshot. Now that you guys are like, well, this is great. I know what things to look for, but I don't know anything more about it. Where can I learn more information? This is where I shamelessly plug the information that I put out there for you guys. It's for everybody. You can go onto my YouTube channel, Dr. Cliff AUD, and I have over 100 videos at this point where you can learn about almost any topic you want to. I do technology reviews in there of hearing aids, of hearing related products. I talk about buying hearing aids in different forms, either online or on eBay and Costco. I talk about things that you should expect from a hearing care provider and what those things look like to see, when you go into a hearing care provider, if they're actually providing you with the things that you're asking for. And it's just what I think to be an incredible resource for you. And at no point do I ever try to sell you anything, right? This is just purely information for you. If you're someone who is in my area and wants to come see me, great. If not, if you live in another state, I'm very happy to even chat with you via email or over the phone to kind of get you pointed in the right direction. But there is no reason that anyone should sacrifice quality hearing treatment, regardless of where they go. So kind of my final verdict on Costco is that I think Costco is absolutely the right place for particular individuals, particularly if you live in an area that has a phenomenal provider inside of that Costco. So that being said, that concludes what I have here for you guys, and I am more than happy to answer any questions that you may have.
Thank you so much. I think everybody's wishing that they could clone you and put you in their private practice or Costco near them. And definitely, I'm glad that you showed your YouTube channel, because you have so many great videos. And that's actually, I think, how I stumbled upon you in the first place. I maybe retweeted one of your posts. We have several questions. A couple of them have to do with telecoils. So maybe I can, if everybody's who's asked that same question, listen up. Do the hearing aids offered by Costco come with a telecoil, and do the providers regularly counsel on the telecoil and its uses?
So the telecoil is a device inside of a hearing aid that will connect with the teleloop that is inside of different types of facilities like churches, movie theaters, and it will allow you to directly tap into the soundboard of that facility, so you can essentially wirelessly stream that audio into the hearing aids. It's one of the earliest forms of wireless technology that we have. And the answer to the question, the first part of the question, is yes, Costco does have models of devices that do have telecoils inside of them. But again, this comes down to, is the hearing care provider identifying these particular needs and wants of you as an individual? And so if a hearing care provider doesn't go into that type of information or dive that deep into your case history and understanding of you, it may not come up as a recommendation. There are usually, and I can't speak for every Costco provider on this. There are probably Costco providers that they directly ask every single one of the patients, do you go to these type of facilities? Do you want a telecoil? And this is what it is. But this really goes back to the point that I made, that it really is your responsibility. If that's something that's important to you, and I do think telecoils are vitally important for many types of individuals and hearing losses, that it's your responsibility to say, hey, I want to make sure that this hearing aid has a telecoil. Can we please make sure that it does? And if you do that, they will absolutely make sure that it's in there. And then the quality of programming inside of the telecoil part of that hearing aid, the telecoil program, is on their shoulders to make sure that they do a good job of programming that.
Mm-hmm. But there are states, correct, that require audiologists to talk about the telecoil with their patient?
Yep, and they should at that point, and I believe it's even required that they have it inside of the purchase agreement, that it has been talked about in that particular state. And I know here in Arizona, we do have to talk about the telecoil in that situation. And but again, I mean, things being required don't always happen. I mean, it is technically required in certain states to perform real ear verification, and we flat out know that is not happening in some of those states, and it comes down to, are they going to be regulated or not? And so you can't rely on regulations and laws to control what quality of care that you're going to get for hearing treatment.
Okay. One person did comment that she bought a pair of hearing aids from Costco and realized later that they didn't have the telecoil, And even after the warranty, they replace them.
Oh wow, that's terrific. You
Yeah.
know, and Costco really is. I mean, I can't speak highly enough of their, you know, their flexibility with, you know, their return period and their warranties and their willingness to make things right with their patients. They really are, in most cases, really good with that.
hmm This next one is a little bit lengthy, but bear with me. Barbara says, companies that make hearing aids are good technically, but my experience is that they do not invite input from their users. My aids are from Resound. Whenever it has been necessary to send them back for repairs or adjustments, it takes 2 weeks. Anything sooner costs extra and still takes at least a few days. I go to a high-end clinic where everyone seems to have been trained by the hearing aid companies to sell a particular brand. As a result, the last time I replaced my aids, I was encouraged to try a different brand. This was a disaster, and after several adjustments, I asked to go back to my brand. And then when I asked, they gave me the other brand. They admitted that they liked the other company better. I paid $7,000 for Bluetooth-enabled hearing aids. My question, how does this kind of feedback get to the manufacturer?
Yeah, so we have to remember that, you know, it really depends also on the hearing clinic that you go to. So Resound, for instance, I can send a hearing aid back to Resound and get it back in 7 days or so. So, I mean, it just depends. I mean, is that clinic not getting them back to you because they have a lot of other stuff to do? They have a lot of other hearing aids that are going back, and in terms of their handling time, it takes longer for that particular clinic to get this thing done. Are they, when you're paying for $7,000 worth of care, is included in that care, is there expedited, you know, repair service included, or do you have to pay extra for it? It sounds like in this case, even though $7,000 was spent, it didn't include expedited care. And so a lot of this stuff does fall on the actual hearing care provider. Hearing aid companies, I think that they try to do the best that they can, involving, you know, they have hearing aids coming back for repair from all over the place. And I know that that's a bad excuse when you're spending that much money, but some of that responsibility falls on your hearing care provider. And if they're not actually getting those devices out the door as quickly as possible, then that's a discussion that has to be had with the provider as well.
Okay. What is the lifetime span for hearing aids, and would the lifetime span maybe of the Kirkland brand differ from other brands?
Right. So the lifetime of a hearing, it's going to be different whoever you talk to. I have patients who have hearing aids that are over 12 years old and they're still happy with them. Do they perform the same way as a brand new hearing aid would? No. But, you know, I tend to tell patients, if you take really good care of your hearing aids, you're dehydrating them every night, you're getting your consistent follow-up care to make sure that they're maintained consistently, you should be able to get 5 to 7 years potentially off of those. And then there's some hearing care providers, they say, well, you're at year 3, you should really start considering new technology. So it really, again, comes down to how well you take care of those devices. And if you want to maximize the life of your devices and you don't want hearing aids sooner, then you really need to make sure that you take care of them. The other part of that question is would a Kirkland brand hearing aid have less longevity potentially as another name brand hearing aid? And the answer to that is no. And I don't even have to elaborate on that. They're hearing aids, the same type of thing, right? They're manufactured by the same companies that make these other hearing aids that could have the potential to last a long time.
Do the Costco's have licensed audiologists in all of their locations?
Not licensed audiologists. They have licensed hearing care professionals, but some of them are hearing instrument specialists. The audiologist, a doctor of audiology, or a master's of audiology, is essentially the highest level of hearing care professional that you can find. That being said, to specifically work with hearing aids, you don't have to be a licensed audiologist. You can be a licensed hearing instrument specialist. They have a variety of different types of requirements based on the state in terms of education level and licensure. But you can get quality care from a hearing instrument specialist. I want to make sure that I say that plain and clear. They just do not have the rigor of training that an audiologist would.
Does Costco provide training in addition to what they might have gotten elsewhere?
Yeah, so any hearing care professional, based on their licensure standards, will have to obtain certain levels of continuing education credits. I don't know the answer to does Costco actually set up its own little clinics? I like to think that they probably do. But regardless of that, these hearing instrument specialists or audiologists have to get the same amount of continuing education that any hearing instrument specialist or audiologist would be required to get in a given state.
Okay. The kind of testing that you were talking about a little bit ago, the real ear measurement, we hear from a lot of people that they've never actually had that done. In fact, one of the staff people here said last year was the first time her audiologist ever, she went to a new audiologist, and that was the first time she ever had real ear measurement testing. Why is there such a discrepancy in the profession? Some do, some don't. We know that it's really best practices.
Yeah, this is, I feel like this honestly is the thing that really gets at my core the most out of everything. All of the research points towards real ear verification, real ear measurement as being one of the most vital parts of a hearing aid fitting to ensure that you're actually achieving audibility of the sound coming out of the hearing aids. To answer the part of the question is why more hearing care professionals don't do it is we don't know, and we've been trying to figure that out for a while. The numbers seem to stay stagnant around the 30 to 40% of hearing care providers actually do this. I, on a daily basis, get emails and phone calls from across not just the United States, but the world, because they've seen that particular video where I am talking about what it is. And they're like, can you help me find someone who does this? And not only that, they said, I went in and I asked for it, and they said, oh, that doesn't make a difference. We can do just as good of a job with the manufacturer software, when in fact the manufacturers will tell you that you should be running real ear measurement on their products. I have to think that it is some level of just not being caught up on the research, right, that has been around since like the 70s, because it's been around for a while. Mm-hmm. Or there some level of laziness potentially. I mean, I hate to say that, the L word, but some level of laziness of, not wanting to take the time to learn how to do it, to take the time during a patient appointment. It's much easier to say, how does that sound when you make an adjustment on the manufacturer software, rather than actually put the sound in that's supposed to be there and you know what they're getting, and that way you don't have to ask that question. Mm-hmm. And then there's the aspect of expense. I mean, it costs more money to acquire the equipment to run it in a clinic, and time is money as well. So if it takes me more time to run these measures precisely, then that's something that I have to be willing to give up. And I'm not going to charge substantially more in order to do it. I feel like that is standard of care, whether you spend $100 on a hearing aid or you spend 10 grand on a hearing aid, you should have real ear measurement done on them.
Do you sell hearing aids that are $10,000?
I don't. Some do.
So following up on the real ear measurement, is that something that a patient should ask for, to see that graph, to see how those lines match up?
Yep. I totally believe that they should. And and if they explain it while they're doing it, even better, because then you'll know if you're achieving the best you possibly can with your hearing treatment. It shouldn't be some ambiguous thing that I think these hearing aids are programmed the best they possibly can, because it is a known thing. We can know whether they're programmed correctly. And if the way that you ensure that a hearing care professional is actually doing them on you, you need to see the graphs and you need to see these the measurements line up. And if they're not putting a little rubber probe tube inside of your ear along with your hearing aids, and you are not having real ear verification done.
Mm-hmm. Okay. Um, Next question. One ear is really bad. I'm assuming the hearing is really bad in that ear. I'm planning to get a single aid for the good ear since I understand that sound into the bad ear is actually making overall crowd hearing worse.
Okay, so is there a hearing loss in the better ear? So this is a more of a technical question, right? So I need to know if the better hearing ear actually has a hearing loss or if it doesn't have a hearing loss. The
Mm-hmm.
opposite side ear, if the recognition testing tells us that their speech understanding is extremely low or non-existent in that ear,
Mm-hmm.
you essentially have a couple different options. You could put a cross transmitter on that ear and route that signal over to the better ear. So if someone's talking on your bad side or your essentially your dead ear side, then you would be able to hear someone talking on that side. You would just hear them in your better hearing ear. If you also had a hearing loss in that better hearing ear, you could amplify that sound as well to make it more audible. And then there is a situation called amp cross, where if you have maybe tinnitus that's caused by that particular hearing loss in the dead ear side, and the incorporation of sound into that ear limits that tinnitus, then you could use amp cross, which is similar concept. You're routing sound from the bad side to the better side and giving it amplification if necessary based on the hearing levels. So I kind of ran through the whole gambit there. So whoever asked that question, you can kind of sift that out for yourself.
Okay. Sounds like a trip to a good audiologist is in order. Um, if you wouldn't mind, Dr. Olson, if you could go back to your slide that shows what's included, the free hearing test, and so forth. The question from Joan is, does Costco charge for each subsequent visit, and how much do they charge? This could potentially make the hearing aids more expensive. So I just wanted to clarify, when you say, there's free follow-up visits and so forth, basically they're bundling all of those services into the cost of the hearing aid. Is that correct?
That's correct. Costco does follow the bundled model of care, and I'm almost there. Bear with me. So you will not spend more money with them for different services that you need to go into. As far as I know, there is no time limit on this. I mean, in perpetuity, you could go in and get these follow-up checks. It's all included in the initial price that you spend. There are hearing aid clinics that also give a bundled model of care that you can, you pay that amount up front, and then for a certain period of time or ever, you get that follow-up care it's all been included. And then you can go to different clinics that are either completely unbundled, where the cost of the devices is separate from the cost of the services that you receive. But Costco does in fact follow a bundled model of care.
Okay. Thank you for that. Carl writes, I've been told that the telecoil is old technology and is being displaced by newer stuff. So how does one know, can they get Bluetooth and a telecoil, or should they pick one over the other? Or does it really matter, depend on the person and what their listening situations are?
Yep, depends on the person. They are not mutually exclusive. You can get one and have the other at the same time. You can get one or the other. And again, this comes down to identifying your specific needs as an individual. And I would agree with the statement that telecoils are old technology, meaning they've been around the longest, right, in terms of wireless, but they absolutely do serve a function, and an extremely important function, depending on the facilities that you find yourself in. If you, and I just had actually a patient today who goes to the theater all of the time. That particular theater has a teleloop, and it would be a disservice to him not to say, hey, did you know that your facility that you just got done telling me about that you love to do all of the time has a loop? We should probably get a telecoil inside of your hearing aid. And that's the route that we went. We got the Telecoil. So it's all technology, but it is still relevant. And that's the thing that's amazing. And I did a couple videos about wireless technology, one of them on my channel, one of them on Hearing Tracker's channel, but talking about how wireless technology just seems to just stick around. I mean, all of the different forms of wireless technology inside of hearing aids still exists, which is amazing, but it's still relevant, absolutely.
Okay, good. Next question. How do you dehydrate hearing aids?
Yep. So they actually have specific dehydrator kits for hearing aids, and they have a couple different types. There's some passive moisture removal that you just put your hearing aids in a jar that has some silica beads in it. Those silica beads will absorb any moisture that falls off of the hearing aids. Then you have active moisture removal, which is where you actually plug these devices into the wall, and it forces warm air through your units and pushes moisture out, causes evaporation, and then sucks it up inside of a dry brick. And the funny thing is, so I'm in Arizona, and I have patients come in from all over the place saying, oh, we're in Arizona, we don't need to dehydrate our devices, we live in the desert. And then I had a guy last week who brought in his hearing aids that were completely corroded because he thought that just taking a little beef jerky packet and putting it inside of his hearing aid container would keep his devices dry, and they completely corroded out, and they had to go back in for repair. Side note, that repair took 4 days.
Okay. Mark says, I was told by Costco hearing aid staff my Burnaphone Bluetooth must have a separate program, but a rep said telecom lost. I'm not sure what that means. Comes in automatically and does not need a program.
I don't know if I can answer that question. I don't work with Burnaphone a whole lot. I would say that standardly that Bluetooth happens relatively automatically, right? As you pair it with a particular device and it just works. Now there's particular streaming programs. If you want to adjust the amplification in a streaming program that is pulling from Bluetooth, you can do that. But in terms of the connectability, it should be, for most cases, automatic.
Right, okay. John says, is it possible to develop tinnitus as a result of having your hearing aids overprogrammed in the higher frequencies? I never had tinnitus until most of my recent aids, Siemens, being I felt overprogrammed in the high frequencies. My audiologist said no way do hearing aids cause tinnitus.
I mean, that's hard to say. I will say this, these tinnitus relief programs that they put in some hearing aids, certain manufacturers won't put those white static noise in there if that receiver power is too strong. So I'm not going to say that hearing aids can't cause tinnitus if they're over-programmed. I'm just going to say that it is highly unlikely.
Okay, I've never heard of that either, but very interesting question. How often should we go back for follow-up care, and what should be expected at those appointments?
Oh, yes. This is a fun answer. So 3 to 6 months, depending on the level of need that you have, right? So if you're really good at maintaining your own devices, you can typically go longer on that spectrum. But what should be happening when you take hearing aids back into a hearing care provider, they should be doing a detailed cleaning, meaning they should be suctioning out areas of that hearing aid that you cannot get to at home. I even disassemble hearing aids in my office to suction them out even better. You can also identify if there's moisture buildup that way. And then you reassemble them. And then another thing that they should be doing is test box measures. So this is another thing that it goes highly underutilized inside of clinics, is the ability to actually test and see, do a diagnostic test essentially to see if that hearing aid is functioning properly. And you can stave off certain issues that you might not perceive to be an issue yet, but you identify in a diagnostic test and say, you know what, we need to get this device fixed so this doesn't become a problem, or so you don't actually go through a long period of time where you're not actually hearing your best. And think of it like a car. When you take your car into the dealer and they actually hook it up and run a diagnostic on the car, that's what we should be doing on hearing aids themselves. And that will identify to us a lot more information that we otherwise might not actually identify. Just doing a listening check won't identify all of the malfunctions that are happening inside of a hearing aid. So this type of stuff should absolutely be happening. It's up to the provider and their facility whether or not they have the capability to kind of show you what they're doing. But even if they don't show you what they're doing, they do have the capability to do a printout of your diagnostic test and compare it to manufacturer specifications of where your hearing aid should be performing. And so if they're not, I mean, my patients get to watch me do it on the screen, and they can see the curve of their hearing aids saying whether or not it's performing appropriately or not performing appropriately. But you could just do a printout and show the numbers and show whether or not a hearing device is actually malfunctioning. So it's a lot more than just listening to it. Okay, we brushed it off, we suctioned it out, you're good to go. If they're doing a really detailed job.
Okay, and so if you weren't hearing your best, would you expect that you would have that real ear measurement done each time you go back and report, oh, I don't feel like I'm hearing my best?
Right. Yeah. Good question. I don't do it every single appointment. I do it definitely at the very first fitting appointment. I do it at the very end of the fitting period if we've backed things off and have progressively baby stepped our way back up into prescription. There are cases where it's hard for a hearing care provider to identify what is actually happening unless we know what's happening inside of your ear. Do I think it's necessary to do every single time you go to a hearing care professional? Absolutely not. And that being said, there are certain types of hearing loss that real ear verification, getting you up to complete prescription is not going to be a possibility. And sometimes it can actually be a detriment. But again, it's your hearing care provider's responsibility to know what's actually happening inside of your ear and if you are at the ideal settings for you and your hearing loss.
Okay. One last question, and I'm sorry. I know that there's a lot of questions we didn't get to, but a lot of them on Telecoils, for example, I think you answered pretty well. One last question. How do you think the over-the-counter hearing aid bill of 2017 is going to affect Costco? And maybe you have some thoughts on how that's going to affect your practice as well.
Gee, I don't know how it's going to affect Costco. I like to think that Costco probably isn't going to be affected a whole lot. I think the industry is going to improve as a whole with that because I think that there'll be regulation on companies that aren't currently being regulated. And, from a personal perspective of me being a clinic owner, I think it's a good idea to have people have access to hearing treatment. There's people who don't live anywhere close to me or close to a Costco or close to any other hearing aid dispensing clinic. And for them to be able to actually have regulated devices that they can get access to, I think that is a good thing. I know that there's a lot of my colleagues who do not agree with me. They think that it will sacrifice quality of care. And you know what? To be honest, it probably will in some cases sacrifice quality of care. It will probably let certain ear conditions go undiagnosed because of individuals trying to self-treat their hearing loss. But at the end of the day, who am I to say that an individual doesn't have the right to pursue that on their own? I think that I'm going to be okay. I think that Costco is going to be okay. I think that hearing care professionals, as long as they're doing their job the right way, they're going to be okay. The ones who are not doing their job the right way, I would probably hate the bill too if I didn't do my job the right way.
Right, but it also may give you depth of your product line as well, and be able to treat people who don't need all the bells and whistles, might just need a little hearing enhancement every once in a while.
Totally agree.
Yeah, maybe open up the market a little bit or bring more people into your practice that wouldn't have otherwise, right?
Right. This is America. This is America. I mean, we should have the rights to, to be consumers, right? I mean, to have it regulated to a ridiculous degree is never a good thing either way. But I think overall it could have the opportunity to be really good for consumers and for professionals.
Right. We agree. I know that there's a lot of questions that we did not get to. If you have any burning questions that you'd like me to forward on to Dr. Olson, please feel free to email me those. My email, I think everybody has, but it's N like Nancy Macklin, MACKLIN at hearingloss.org. And I will forward those to Dr. Olson, and the recording of tonight's webinar should be posted on our website within about a week, hopefully. And again, I thank you so much. This was very informative, and I really appreciate your time tonight. And thank you, everybody, for attending, and we'll see you next month. Thanks again.
Thank you so much.